I grew up in a household with a nurse as a mother and a father who was a practicing oncologist. And so I've grown up understanding some of the challenges that oncology patients face. It's devastating for a patient and their family to receive that diagnosis. It became very clear to me that there's this gap out there of people that don't know how to navigate, what do I do when I get a diagnosis with cancer? It's not nearly as bad of a diagnosis today if you get access to great care. I've been on a mission since I started at Mainline Health and even before to do all I could to eliminate disparities in care.
The Jack Lynch Cancer Initiative, Closing Gaps in Care. A lot of time and effort went into developing that program. We're asking philanthropists to really contribute and help us make a lasting impact for Jack and also a meaningful impact to the community.
We are expanding and building out our community health worker model and seeing folks in the community who are natural advocates. I'll give you this example. Patients who may be underinsured that we need to apply for financial assistance for, patients who can't afford their medications. So then the community health worker works with them to establish care with a physician and to get that appointment. And then to make sure that they have transportation to get to that appointment and to be established as a patient. That's a huge gap. And that's very real. It makes a huge difference when someone is walking alongside of you in your journey.
We're very excited about the concept of a Jack Lynch Equity Fellowship. Jack has been an equity champion in the Mainline community. But we realize that we service a lot of different communities and sub-communities, many of which have specific oncologic problems and many of which are disadvantaged. As we grow in our ability to identify disparities, the need for this work becomes ever more important.
Cancer is treatable. Every stage of every cancer is treatable. The management of cancer has never been better across all the disease sites than it is right now. Teaching people to embrace all the new opportunities that are available, all of those are ways that we close those gaps and that we bring the same level of care to all of our populations without disparities. And that's really important. It's on us to assure that everyone has access to that defined clinical pathway from early diagnosis to definitive treatment and ongoing surveillance.
Whoever you are and whatever you are in your situation in life, that you have resources, that you have someone to walk with you through your process so that you are concentrating in your health and your care and not on these other factors that might influence your outcomes.
12 years ago, 13 years ago, I went to one of the doctors in Philadelphia. They took another PSA and it bumped up to very high. He rechecked everything and he's never seen anything come back that aggressive or that much in 23 years. So that was the beginning of my onset of all the cancer I've been through recently.
We were also dealing with the fact that financially life really changed. And then this hit. But Gabby, I can't begin to tell you what her support has done. And the volunteers everywhere. But Gabby helped us get back on our feet.
We know that there are gaps here at Mainline Health, and our commitment is to close gaps in care for cancer patients that walk through our doors. My commitment is that I am going to partner with any and all philanthropists, regionally, globally. We are going to raise millions, and we are going to do that with your help. And I empower you to be a part of it.
So what we ask of you is to be generous in your support of an initiative that's important to Jack, important to Mainline Health, and important to our community.
It is a reward, by the way, guys. When you donate, you have to, there's strangers out there that you're donating to who need your help.
Understanding the impact that this fund is going to have going forward is overwhelming. The fact that these efforts will be able to have an impact forever, that we've settled in on a crucial need for your community, my community, around cancer care and closing those gaps is a little bit overwhelming. But it's something I've worked my entire career towards. and that is making sure people have access to safe, high quality, equitable, and affordable care. And I can't tell you how grateful I am to the Mainline Health Board for putting this program in place. And to all of you, for that I say thank you.